Hello, my name is Dr. Dewan S. Raja. Today I will discuss about osteogenesis imperfecta. What is osteogenesis imperfecta? Osteogenesis imperfecta is an autosomal dominant disorder. Phenotypically diverse disorder is also called brittle bone syndrome because bones are prone to be fractured. There is defect in collagen type 1 synthesis, most common inherited disorder of the connective tissue. Osteogenesis imperfecta principally affect the bone. It also affects other tissues rich in type 1 collagen, like eye, joints, skin, and teeth. There is extreme skeletal fragility. Blue sclera caused by decreased collagen content. Hearing loss. Hearing loss may be conductive type of hearing loss, may be sensory neural hearing loss. So there may be damage in the ossicles and the external auditory meatus, bony part of the ear, or there may be damage to the internal ear involving the cochlear nerve. Dental imperfection, small, misshapen, blue-yellow teeth, secondary to deficiency of dentin. Okay, so if you look at the sclera, this is the sclera. It is blue color, even more blue than this in certain individual because of lack of collagen. The choroid underlying the sclera is exposed. It is very much exposed in this image. So this part is bluish color. Even it may be very blue, maybe less blue, depending on the amount of collagen. Okay, so blue sclera with patient with osteogenesis imperfecta. Here, if you look at the teeth, we'll see teeth is lacking dentin. Okay, a patient with osteogenesis imperfecta, opalescent dentin, bite-wing radiograph of the same patient showing shell teeth with thin dentin and enamel of normal thickness. So enamel is normal, but the dentin is thin. Okay, so we'll get bite-wing radiograph of the same patient like this. Okay, and here there will be deficiency of the dentin. Enamel is more or less normal. Okay, so what happens? Again, what is the pathogenesis? Autosomal dominant mutation in the genes that encode alpha 1 and alpha 2 chains of type 1 collagen. This defect causes misfolding of the mutated collagen polypeptide and interferes with the proper assembly of the wild type collagen chains. So this is the X-ray of a fetus, and there is a lot of fracture. Okay, fracture, rib fracture, limb fracture. Skeletal radiograph of fetus with a lethal type 2 osteogenesis imperfecta. There are numerous fractures of the virtually all bones, resulting in accordion-like shortening of the limb. Okay, this is the most lethal form. We have around 4 forms of osteogenesis imperfecta. Type 2 is the most lethal form, and we'll get this type of presentation. Fracture of the almost all bones during the intrauterine life and also in the perinatal life. Okay, has 4 subtypes that vary widely in severity. Severity of the disease is based on location of the mutation in their protein. It may be mild or severe on the basis of collagen synthesis. Type 2 variant, just we have seen, is fatal with repeated fracture during intrauterine and perinatal periods. Type 1 is the mildest of all with a history of fracture during childhood, but as the age advances during adolescent period onward, usually there is no fracture. But most of them reach adulthood. The type 1 type. And that's all about the osteogenesis imperfecta. If you have any question, please feel free to ask me. Please support my channel. Please subscribe me. Share the information with your friends. Have a nice, wonderful, and blessed day. Bye now.